Our project is on alcohol-related liver disease. What is alcohol-related liver disease? Alcohol-related liver disease, diagnosis code K70.9, is a condition where the liver is damaged by excessive alcohol misuse over a period of time. Alcohol-related liver disease affects millions. In 2022, of the 98,457 liver disease deaths among people ages 12 and older, 46% involved alcohol.
Alcohol and the human body. So, according to Alcoholic Liver Disease Stats Pearls NCBI Bookshelf, of the 98,457 liver disease deaths among people ages 12 and older in 2022, 46% involved alcohol. Among males, 60,412 liver disease deaths occurred, with 48.6% involving alcohol. Among females, 38,063 liver disease deaths occurred, with 41.8% involving alcohol.
Here we have a diagram of alcoholic liver disease, the stages. First, we have the healthy tissue and what a healthy liver looks like. And then we have an alcoholic fatty liver, which then turns into alcoholic hepatitis, and then eventually cirrhosis. Here we have another diagram. First, we start out with a healthy liver. It's the largest gland in the body and is responsible for functions such as protein synthesis and detoxifying chemicals. When it is healthy, it's a reddish brown color with a rubbery texture. Then we have the fatty liver. The fatty liver begins to become damaged from excess of alcohol intake. It begins to get a yellow tone and becomes greasy. This, however, is reversible. The next one we have is the cirrhosis liver. Liver cirrhosis leads to severe scarring due to long-term damage, resulting in a bumpy appearance. The healthy liver tissue is replaced by scar tissue, causing the liver to eventually fail. This, however, is not irreversible.
The alcoholic liver disease, we have the healthy liver, fatty liver, and cirrhotic liver. In the healthy liver, we see the liver as the largest gland in the body, responsible for functions such as protein synthesis, detoxifying chemicals. When healthy, it is a reddish-brown color with a rubbery texture. Next, the fatty liver begins to become damaged from excess alcohol intake. It begins to get a yellow tone and becomes greasy. This is reversible. Then we have the cirrhotic liver. Liver cirrhosis leads to severe scarring due to long-term damage, resulting in a bumpy appearance. The healthy liver tissue is replaced by the scar tissue, causing the tissue to eventually fail, which is not irreversible. What is the fatty liver? A fatty liver is a buildup of fat on the liver and affects more than 90% of those who regularly have a high alcohol consumption. It can be diagnosed with an ultrasound or blood work. Symptoms include fatigue, dull aching pain in the upper right abdomen, jaundice, which is yellowing of skin, dark urine, loss of appetite, and weight loss. Treatment options include better nutrition, stop drinking, exercise regularly, limit over-the-counter medicines. So here we have alcoholic hepatitis. What is alcoholic hepatitis? This is the next step of alcohol liver disease, which can occur if regular misuse of alcohol continues in patients with a fatty liver. Symptoms include jaundice, which is yellowing of skin and or eyes, nausea and vomiting, fatigue, fever, and fluid buildup in legs and abdomen. Treatment options include stop drinking, better nutrition, hydration, and steroids to help reduce inflammation. So here we have cirrhosis. What is cirrhosis? It is the final stage of alcohol-related liver disease and is irreversible. It can cause liver failure, which can lead to death. Symptoms include, but are not limited to, upset stomach, jaundice of skin and or eyes, confusion and drowsiness, and weight loss. So here we have the fatty liver, and this image we can see how the liver transforms from a normal liver into a fatty liver, and then how its end results are at a cirrhotic stage. So here we have how is alcohol-related liver disease diagnosed? We have assessment of medical history, addiction HX. We have lab work, CBC, CMH, AST, and ALT. We have abdominal ultrasound and liver biopsy.
All right, and here we have a assessment tool that we use when patients come in for an assessment. The first question, how often do you have a drink containing alcohol? How many standard drinks containing alcohol do you have on a typical day when you are drinking? How often do you have 6 or more drinks on one occasion? How often during the last year have you found that you were not able to stop drinking once you had started? How often during the last year have you failed to do what was normally expected of you because of drinking? How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session? How often during the last year have you had a feeling of guilt or remorse after drinking? How often during the last year have you been able to remember what happened the night before because of your drinking? Have you or someone else been injured because of your drinking? Has a relative, friend, doctor, or other healthcare worker been concerned about your drinking or suggested you to cut down? These are some questions that help assess the patient and where they are at in their addiction. Here we have a diagram of what's a standard drink. Although the drinks pictured here are different sizes, each contains approximately the same amount of alcohol and counts as one U.S. standard drink or alcoholic drink equivalent. Is alcohol-related liver disease preventable? Yes. To prevent alcohol liver disease, patients must stop drinking, maintain a healthy lifestyle, and exercise regularly. Ways to stop drinking. Many patients with alcohol-related liver disease suffer from alcohol addiction and or dependence. Diagnosis F1020, DSM-5, 30390, and 305. Patients who suffer from alcohol dependence are recommended to detox in a facility so they can be monitored and given medication for any withdrawal symptoms they may have, such as diarrhea, vomiting, chills, blood pressure spikes, which could lead to stroke and possible seizures. The next treatment would be MAT, medicated assisted treatment. Usually when we have a patient come in, they are a their history is gone over how long have they been drinking, how much should they drink a day, do they usually drink first thing in the morning, how are their eating habits, are they avoiding eating and drinking so that they can feel more drunk quicker, and they are asked their family history. Is there any family history of addiction? Is there any mental health issues that run in the family? Do they have withdrawal symptoms when they quit drinking? Can they quit on their own? Chronically alcoholics that have been drinking for many years are recommended to go into detox and not recommended to do it alone. The ones that are able to a few days in order to get naltrexone. First have labs done to monitor liver enzymes, and then they are placed on naltrexone, which is the oral medication, and it helps with cravings by blocking the receptor. If they were to drink, they do not get the high or drunken effect. If they do drink, they have to be off of any opiates for at least 7 days before getting the oral naltrexone. Patients must not drink alcohol 4 to 7 days before getting naltrexone, because if they do use opiates or drink, they will have precipitated withdrawals. Now, after the naltrexone, we have the injection Vivitrol. Vivitrol is a once-a-month injection. It's given in the gluteus. It works the same way as the oral naltrexone, as it sits in the receptor, blocking it so nothing can get into the receptor. So if they were to drink, they don't get the drunken feeling. Patients have also said that it affects the way the alcohol tastes. It helps with cravings that way. The goal for Vivitrol is, of course, to eventually stop drinking. However, it's also, if the patient goes from drinking 7 beers a day down to 2, then it's working, and that's what we want. The next one would be Campril. It's an oral medication that decreases cravings by helping the neurotransmitters in the brain. The other medication we have is Antabuse, which is an oral medication, and when the patient drinks while on the medication, they get extremely sick, headaches, nausea, vomiting, weakness, mental confusion, anxiety. It's really riskier than other medications, and it can raise blood pressure, which can lead to heart attack, so many doctors don't like using it. To go along with all of these treatments, counseling is highly recommended. I feel that everybody should do counseling even if they don't have any issues, because everyone's got some sort of issues they can work on with counseling. Another way to prevent alcohol-related liver disease is to have a healthy lifestyle. Diet fruits, fiber-rich, low-carb vegetables, lean meats, limit sugars, limit carbs, lots of water, whole grains, and also the Mediterranean diet is preferred. Patients should also exercise daily, aerobic exercise, resistance exercise, yoga, cycling, swimming, or even sports.